Welcome to Are You Missing Silent Cat Health Signals? Experts Litterbox Debate, hosted by PETKIT. My name is Summer, and I'm excited to bring together leading voices in veterinary medicine, animal behavior, and pet care community to discuss one of the most underestimated topics, litterbox care. The reason we are hosting this roundtable is simple. The statistics are concerning. Despite 42.1 million cat-owning households today, a 2020 animal study found that only 40% of pet owners visit the vet annually. Research from Walton and the University of Bristol reveals that over 50% of cat health issues go untreated, highlighting the critical need for proactive monitoring and early intervention. Our goal today is to shed light on these silent health signals, provide practical advice, and explore how technology can help bridge the gap to better pet care. We'll cover why monitoring your cat's litter box habits is so important, the unique challenges faced by multi-cat households, and innovative solutions to make preventative care more accessible. We're excited to have Emmy Award-winning veterinarian Dr. Jeff Weber, famously known as the best vet in Norway, as our moderator. With his expertise and charisma, Dr. Weber will guide us through these critical topics and maybe even settle a few debates along the way. Dr. Weber, why don't you take it from here, share a little bit about your incredible journey, and introduce our fantastic panelists for today.
Certainly. So I don't know about charisma, but experience, yes. So I'm a 1984 graduate of UC Davis. So I've been doing this for just over 40 years. And, for me, it's been a joy. I mean, you're going to have to pull me away kicking and screaming. I am a pet lover, one of those idiot vets that want to do this since she was 5 years old. Here I am 40 plus years in, and I still love it. I practice daily. We have 9 pets at home because I don't get enough at the office every day. So I get to come home to 5 dogs and 4 cats. And so, of course, being a dad of 4 cats, this is a very interesting topic to me. And I'm thrilled to be here and just to introduce you also to our wonderful team of experts in our very different fields. So in no particular order other than just what's going on my screen. So why don't we start with the upper right for me, which is Dr. Sarah Witten, who's also a veterinarian, a colleague. And so tell us a little bit about yourself and how you got interested in this.
Hi, Jeff. Hi, everybody. Thanks for introducing me. My name is Dr. Sarah Wooten, and I am also a UC Davis graduate, class of 2002, tracked small animal, and I practiced for 16 years. And during the time that I practiced, I realized there was still a long way to go with education and technology and tools that could help pet parents better care for their animals, and that we were actually missing a lot of disease. And instead of being proactive, we were putting out a lot of fires that if we had caught them earlier, it would be easier and better for the pet. So I'm interested in things like this because I love new technologies that can help help pet parents monitor their animals better. And also, this is really interesting to me as a veterinarian because of the data piece. Because a lot of times when we're in the practice, we only get a snapshot of what the pet parent is telling us. But if we knew what was happening over the past month, that would be amazing. So something like this is really interesting to me as far as a way to help cats. And their
Wonderful. Next up on my screen again, we have, it's funny, Nathan, I have to say, calling yourself the cat lady, because I often tease people that I'm a cat lady. So let's hear your background and what brought you here to us, and love talking about cats.
Absolutely. Yeah. So I started out as an actor out here in Los Angeles and started building a social media, ended up posting. I had 4 cats, started posting some videos with them, went viral, and eventually just kind of leaned into it. And like you said, I was getting called a crazy cat lady, and I was like, if I'm going to lean into it, then we're going to make it cool. I was kind of sick of the stereotype. So I made myself Nathan the cat lady and just kind of leaned into it. And then I started learning about rescue and how important it was. So I started jumping into rescue. And since then I've gotten to work with pretty much every pet brand in the industry, seeing what's coming out, what new products are there. Hi, Ginger. I have a large following of people that are cat lovers. So I'm constantly getting to hear what's going on with people and their pets and what they're curious about. And so, now I'm just out here seeing where the world of cat people and cat ladies is going and what new technologies are coming to help out.
So, how many cats do you have?
I have 4.
You have 4. Okay, me too.
Yep.
And just interestingly, side note, we moved to California from New York back in the early '60s because my dad was an actor. So I got some great stories about that too. All right.
Oh, very nice.
Next up, Jill. So,
Hi.
Jill Goldman, PhD doctor and a cat and dog animal behaviorist. So tell us about yourself and how you got here.
Hi, I'm so happy to be here, everybody. So I'm an animal behaviorist, a certified animal behaviorist, and my background is basically with some other creatures besides companion animals, namely wolves and monkeys, and some farm animals. I earned my PhD at York University working with monkeys, and my Master's of Science in Halifax at Dalhousie working with wolves. And now I went to New York City. I was working with the American Society of Prevention of Cruelty to Animals and worked at a shelter there, where I became very familiar with the companion animal population, the shelter population, and the issues that people and animals have to deal with on a regular basis. Since then, I've come to California. I'm based in Los Angeles. I have a private practice. I work with shelters as well as pet parents. And what we're seeing is that, number one, shelters are being overrun. So it's really important for pet parents to understand what's going on at home so that the pet can stay at the home instead of being returned, as well as understand their behavior so that we're not waiting to the last minute to see that there's a major problem that cannot be dealt with. So I work with dogs and cats and people, and it keeps me very busy, and I'm hoping that we can find solutions to keep the animals at home so they don't end up in the shelters.
Wonderful.
And get the animals at the shelters into forever homes.
So wonderful. I thank all for being part of this team. And I'm so glad you said about you're working with the people too, because, there's only so much you can do with it's easier, I'm sure, to work with the cats and dogs than it is to train the owners, the pet parents, to do what's right. So we all agree that there's we know that monitoring plays such a critical role in overall pets' health. So I just want to know, when it comes to litter box behavior, all right, and monitoring, I want to know your sort of your feelings about what the role that it plays and how it helps us as cat people, dog people in general, just keep their lives healthier. So, Dr. Sarah, do you agree that there's a large percentage of cats could live longer if we had preventive care, if we had an expertise in understanding and recognizing the early signs of through monitoring?
Well, 100% yes. I mean, knowledge is power and data is power, and especially when it comes to tracking trends in your pet's health. So I can think of a couple of cases in my own clinical practice that if the owner had only known earlier there was a problem, we could have saved the cat. I remember back when I was right out of vet school, and I had this young man come in, and he had this cat that was old, and he loved this cat so much, and he was like, I don't know, he's just not doing well, doc. And so, of course, I pet the cat, and it's like petting a furry skeleton. It's so skinny. Have you ever pet them when they're...
Yeah.
And you can't tell when you're looking at them because they're covered in fur, but I was like, oh God. And so the cat had chronic kidney disease, and it had it for quite some time. And the owner was devastated and ashamed and sad that he didn't know, because he didn't track any of the toileting habits of that cat. And he didn't know that the cat was peeing a lot more than the cat used to.
Right.
So definitely, I mean, that's just one of hundreds of cases. It probably happened on a daily basis when I was in practice.
Right. And Dr. Jill, how do behavior changes often signal potential health issues?
We're finding out more and more that there's a there is an underlying medical issue in a lot of behavioral cases. Not to say that there's no behavioral problems that are independent, but they are often a manifestation of medical issues. And so what we're seeing is if we had some information about one, how the cat is not going to the litter box. Maybe he has arthritis problems. Maybe he's too old. Maybe he needs some modification. Maybe he's undergoing stress. So in order to get an idea of why the animal is behaving out of the norm, we always want to look at any medical issues that could be underlying the behavior. And that litter box issues is a really good indicator of what's happening with the cat's overall health as well as welfare.
I would totally agree, and I think that it's many times pet parents overlook that. Nathan, you mentioned that you also work a lot with rescues and shelters and things like that. So, with that experience, and you see the challenges that they face daily, especially with unwanted cats. And again, I have 4 cats, and I had 5 recently for a reason. It's because they're all at rescues and they're all coming from shelters. But what seems to be driving the problem that so many cats are either being brought in or not being adopted?
House soiling issues. House soiling issues, litter box issues is one of the main reasons why cats are surrendered to shelters.
Right.
So if we can fix that problem and get it when it first starts to be revealed, then we can keep a lot of the cats at home.
Great. Nathan, you're going to say?
Yeah. We also, one of the things we're noticing now is there's a big influx, with the lockdown during COVID. A lot of people got pets and got cats and they're like, oh, this is going to be great. We're going to have cats. And then, they had to go back to work and they were like, oh, I don't want to deal with this anymore, and returned it. So we got this massive influx with a lot of the shelters I work with, which has become a huge issue. Like Jill said as well, like a lot of people just don't want to deal with the litter box. The cat pees out of the litter box one time, most likely because they're not cleaning it very well, and they blame it on the cat. And, they're like, oh, my cat peed. It's too much. It's too messy. It's too much. And, at the end of the day, a lot of people are, I hate to say it, just lazy and don't want to put in the effort, with pets. And it's become quite apparent with people returning. The huge influx, like I said, with the lockdowns and stuff has been an issue.
So we all, know that this, a lot of this revolves around monitoring, something that not everybody is doing well enough. Do you think that, is it like the pet parents, are they unintentionally contributing to the cat's poor health because of a lack of attention they're paying to their behaviors, especially monitoring their litter box behaviors?
I believe I'm just going to jump in here.
Sure.
Animals are very subtle in their communication signals, and humans are often in need of very overt big signals in order to understand what's going on. So humans aren't as sensitive as they need to be to detect changes. So we often only see the problem when it has surpassed a certain threshold.
Correct.
So if we had a better monitoring system, or at least be more informed as to what subtle cues or signals we should be aware of, then we can catch the issue, like Dr. Wooten was saying, at an earlier time, so that things can be improved and the cat can be in a better place, both physically and environmentally in the long run.
Yeah, cats are very much silent sufferers.
Yeah,
I think is the term that I've heard, where you're not going to know your cat has anything wrong until it's too
they
late,
hide,
because they'll sit there and they'll just suck it up.
Right. Nathan, you mentioned about COVID and the large number of cats that were first adopted, and unfortunately after that maybe brought back. But do you personally have any heartbreaking cases about such cats that really just weren't given enough time to adapt?
I personally, no, I don't. I like just recently, actually, I was just at a cat cafe lounge, and they had 2 cats, and somebody had adopted them together. They're a bonded pair, and they had them for I think a day and a half, and then decided it was too much and brought them back. It just kind of shows the level of patience that people don't have.
Right.
Yeah, I mean, in terms of people specifically because of COVID, I personally don't know any, but I have been speaking to a lot of rescues that said the influx after people went back to work has been wild. I mean, I guess it makes sense. A lot of people are like, oh, I'm at home all the time, I can handle this. And then when they're not at home anymore, and they can't give that amount of time, they realize what kind of responsibility they took on. But
the
And
rate
Dr.
of
Sarah,
behavior. Oh, sorry.
go ahead. No, go right in.
I was just about to say, and that the rate of behavioral euthanasia is through the roof.
Right.
Just for space and for space. So they're medically fine. And if we had the resources, we'd be able to take care of it, because often litter box issues can be resolved. But through the roof euthanasia for behavioral, as well as just making space in Los Angeles in particular, is through the roof at this time.
Dr. Sarah, did you have any comments about any experiences that you've had with something where you mentioned earlier that if they only knew a little earlier, they could have done something about it. But I agree with Nathan, is that many cats do such a great job hiding their illnesses that by the time it's obvious, it's almost too late.
Mm-hmm. Yes, I would definitely agree to that. I would say that, when they're not feeling well, they tend to go hide.
Right.
I still think collectively, as pet lovers, we do think of cats as low maintenance. And so if they're not low maintenance, then if the person is getting it for a low maintenance pet, they're like, wait a second, this is not what I signed up for. So I still think there's a huge education piece. I also know that a lot of people can't afford to have a big dog.
Right.
And so they think that, they can have this little cat, and then that will be less expensive and less difficult. But it turns out these cats are still money, time. And I think in particular, I lived in Greeley for a long time. We have a lot of college students there, and a lot of those college students would come see me with their pets, and they would get their first cat. And we're talking, 19, 20-year-old adults, and they really just had no clue what they were getting into. So I don't think pet parents recognize the importance of litter box monitoring. And I don't think they recognize how much they can benefit themselves and their pets and their wallets by doing this one simple thing.
Right. There's so much we're talking about litter box. Let's talk about that for a second. So do we think the neglect is more because of other external issues around the pet parents, or simply about overlooking the relationship between regular litter box monitoring and a cat's overall health? They don't realize that simple thing about in and out of the litter box and how often and how long and and weight loss and subtle things can actually mean something really big if they paid attention. What do you think?
I was just going to say, I think it's definitely a combination of both. For me, I'm out of the house a lot during the day, and I have 4 cats. So I don't know who's using what, when they're using it, And I, luckily for me, have been, in the industry speaking with experts like yourselves who have taught me, you have to monitor what's coming out basically. But a lot of people I've mentioned that to have no idea, because there's not a lot of education out there about cats, and you need to look at their poop and all that. So a lot of people don't even know. They just blindly scoop and dump it, and they're like, "Oh, that's fine," So I think it's a combination of people they're not home. They see cats as independent, and they just yeah, my cat does what it wants. I know a lot of people will get cats and be like, "Yeah, I travel a lot, so it's nice. I can leave them home for 3-4 days by themselves, and they're fine." And it's like, well, that's you shouldn't. You still have to monitor them and take care of them, but it's this misconception that they can do what they want, they're low maintenance and they're fine. And it's like, no, they really do need to be supervised and fed, and you got to keep track of what's going in and out in their health.
Jill, you're going to say something?
I was just about to blurb in that often animals, cases that had never had an issue before, litter box issue, have now developed a litter box issue exactly when you said, Nathan, when the people go away for a few days, even if they have somebody come over, there is often a problem that develops during the time that the pet parents are away. For whatever the reason may be, I have my own ideas of exactly why these things happen, but it can often be associated with a full litter box, because as we know, cats are very fastidious. They need it to be clean. They need it to be odorless. They need it to be just perfect for them to go. So that is definitely a huge issue. And I just want to add in a little thing about this emotional therapy animal now. And I understand that in some places, I know in Los Angeles, it's, pet parents are beginning to expect the animal to take care of them rather than the pet parent take care of the animal. And I think the reversal of roles may be contributing some of the issue.
Very, very possible. Dr. Wooten, so given the challenges that like owners now we see facing in life, financial, time constraints, they went back to work, pressures at work, pressures in the family, what tools or technologies do you think could help the pet parent monitor their cat's health more effectively, be more consistent, and certainly cost effective?
Well, it needs to be something that's easy to understand and that is highly convenient and actually shows them the value of what they're doing. Because as we've been saying, our clients, these pet parents, whether they're coming to you for behavior or medicine or anything, they are extraordinarily busy, harried individuals. I think about, the single mom who comes in to see me and she's got 3 small children and a cat in a box because hasn't even had a chance to get a carrier yet. And then I talk to her, I'm like, well, you need to see how many times this cat goes in and how long they're in there for. And then if there's any problems, then we have to monitor even more. And then we also need to look at the type of stool and we need to see how much they're urinating or not urinating. And I just see the person's eyes just, it's like the too much information thing. And then they don't get any of it. And then they walk out. And then I see them again 6 months later with a cat with a UTI or a stress cystitis. Right. And it's pissing on their carpet and now they don't want it anymore.
Right.
So it has to be convenient. It has to show the value. It has to be pretty easy. And it needs to help people be able to do what we're asking them to do. Because as the experts, we know the value of what it means to monitor. We know that we could catch a stress cystitis early, or we could catch a bladder stone early, or we could catch diarrhea early, or we could catch litter box bullying early and save these cats and save these people money and keep the families together. But it's just getting that information across to the consumer that these tools could save their life. So when we're thinking about things that we want them to have, it needs to address their pain points, their lack of time, their lack of knowledge, their fear of going to the veterinary hospital because it is very expensive. And then just teaching and helping these people understand that if you monitor this now, you're going to save your cat pain and suffering. You're probably going to save yourself some money. You're probably going to keep this cat in the household. So I would say the things that I would like to see obviously would be something to do with monitoring toileting behavior, monitoring how often, how much, what is going into that. Are there any problems with other cats? The other big problem, no pun intended, is obesity in our indoor cat population. And most people are not aware that their cats are slowly gaining weight or conversely slowly losing weight. So some sort of daily scale that has some sort of trend would be amazing. I would love that. Those are the things I would focus on and really like to see as a veterinarian.
You have one cat gaining weight and you have the other cat in the household losing weight because one is bullying them away from the food and the other one doesn't get enough. That would be an excellent opportunity to monitor their weight before it gets too extreme.
Dr. Jill, you mentioned your clients are, obviously see you because of behavior issues. How do you help them better understand the circumstances determining whether or not it is truly a behavior issue or possibly a medical issue causing ultimately a behavior issue?
Well, the first course of action is to, if they have not yet seen a veterinarian, is to consult a veterinarian. That is the first and foremost. And as the introduction of this segment mentioned, that there are owners that haven't seen a veterinarian in over a year. That's a high percentage. It's close to 50%. So, because I'm aware that behavior is often a manifestation of physical issues, the first course of action is for them to visit the veterinarian. And that doesn't mean that the behavior itself doesn't need to be addressed, because sometimes the behavior will become independent of what originally made, what was the original cause. But nonetheless, we do need to make sure and rule out that there is no underlying medical issue that is causing the animal pain or discomfort or stress or any of those things that would affect negatively their behavior, especially their litter box usage.
Okay. Nathan, your many followers, how do they, like when you, I'm sure you talk about a lot of technology in, with pet care. How do they react to new things? Are they excited? Are they skeptical? Are they want to embrace it? What any new trends that you've noticed?
Yeah, I mean, I definitely say it's a mixed bag. Some people, they're just like, it's too much. I can't, again, there's this common trend of just pet parents being just very lazy. The more you can take off the plate, the better. So some of them are like, I don't know, it's too much. Where there's another side of it that they're like, this is amazing. Like, did you see this? There's this, because especially for cats, it used to be all dogs. Like everything in the industry was dogs. Cats were down here. And just in the last couple of years, it's, there's this for cats, there's this for that, and now people are spending more and more on their cats because they're like, oh, there's all this new stuff coming out. So, it's a mixed bag. I definitely would say the majority of my followers are very excited. They love when I show them new things that are coming out because they love the idea of spoiling their cats, and giving them, because a lot of people do see them as their kids, they're like, no, these are my little babies. I want to give them the world. So a lot of them get really excited seeing all the new technology that's finally coming out for cats.
Great. So we've touched on it already with a couple of answers. And I know already that Nathan has one such situation, as do I, and that's multiple cat households. And I'm sure the norm back in my day, and Sarah, I don't know what it was like with you, but the N+1, that means I'd have 5 litter boxes, and I don't. But so how this new things, new technology out there, something like this, for example, the PureBot Ultra, which is a great new litter box, amazing box that is interestingly giving us all these things you talked about, the ability to monitor which cat and weigh them and get a time frame and keep track of all the different cats. What now with these types of technologies coming out, what does that do to our N+1 rule? What do you think?
Oh, is that one for me?
Anybody?
Oh,
yeah.
Go for it.
I mean, honestly, like, with the new technology of because I think the biggest issue is one, giving your cats like Jill was talking about earlier, your cat's like a clean litter box,
Right.
And we're not always on top of the game of being there to clean it out. That's why they say, have one for each cat +1 so that, they can always find a clean space to go. But if it's cleaning and cycling and, doing it itself, I mean, me personally, I feel like that really cuts down on the number that you need, because then you don't have to worry about, it's cleaning it and refreshing it so they get a brand new litter every time they're using it. So I think that's a huge step in the right direction.
I would agree. I would agree that it's a huge step in the right direction. At least you're making sure that the litter boxes that are available are clean. I do say, though, that it wouldn't take away all the litter boxes, because location is super important. Some cat, and you have to make them available, because if one cat is using the box, then it's not available for the other one, which you want to make sure that the locations are suitable. And sometimes different cats like different litters. So you want to make sure that there's something available for each cat's particular liking. They do have different personalities. They are very unique individuals. And we want to make sure that the litter box is available, clean, and in a quiet location, and has a substrate that is their preference.
So, we've already discussed the range of tools, and I know Dr. Wooten did a great piece on just letting us know all the different things that one would look for if there was such like the one size fits all. But, because of, Jill, what you're mentioning, different litters, different locations, some like it covered, some don't like it covered.
Exactly, right.
I remember dealing with a case where the cat was not going to the litter box. I started asking him about it, all these behaviors. I said, by the way, where do you put the litter box? Oh, we have it down in the basement. What? So you're expecting your cat to go down a little kitty door, down to dark stairs, into a dark room, and now you realize that one of the most vulnerable points in their daily existence is urinating and defecating. A lot of cats want to see everything. They don't want to miss a beat in case that predator is waiting next door. You know what I mean? So sometimes it's as simple as that. So I guess the question is there a one size fits all? Dr. Wood, what do you think?
Well, I mean, I'm still thinking about that +1 rule because that's messing. That's messing with the golden rule. And I'm just thinking about how DVM 360 would feel about this. So, so when I was thinking about this, and then I also think about, I have TikTok. So, and for some reason, my TikTok feed has a whole bunch of like tiny apartments in New York, and they are tiny. And so like, if you have a cat, like, if you have like literally this much space, you don't have room for all of those litter boxes. So in my thought, as far as these litter boxes go, I agree with Jill, Dr. Jill. One size does not fit all. It really depends on the cat. I would say for single cat households, if you had the right kind of cleaning litter box, and the cat liked it and was not exhibiting any problems with it, you could probably get away with not having an extra box.
Right.
Now, if you go into multi-cat households, I would say it depends, right? It depends. You could have 2 cats that are perfectly fine with that one box, and then you could have 2 other cats that just don't. So I would say it's kind of a trial and error thing which is how a lot of stuff in veterinary medicine is. So I would say maybe would be my big answer.
So, all right. So, if you kind of mentioned your points of interest, things that you would like to see to cover certain aspects of what we need to monitor. The weight, the frequency. So, what features would you want to? I'm just going to be for everybody prioritize if you were going to put together that quintessential perfect box.
The dream wish list of litter boxes
in
a veterinarian's mind. Okay, so I'll do veterinary mind, and then we've got cat behavior mind, and then we've got cat influencer mind, right? We've got 3 minds. Okay, so for me, I want it to be able to identify the cat. I want to know what that cat weighs. I want to know if there's any trends up or down. I would like long-term data storage so I could monitor trends over a month. I mean, it's just like watching, stocks going up and down. You got to watch over a month, right? I really love the idea of a visual camera because you want to actually see what that poop looks like.
Right.
I mean, you just do. You want to see if there's worms in that poop. And then in a dream world, in my dream world, this box would send a notification to the pet parent if abnormalities were noted. That'd be amazing.
Dr. Jill, anything you'd like to add? I'm sure there's some stuff. Come on.
Well, just on top, the video camera is the best because I'm a behaviorist and my colleagues are behaviorists, and so all our data is often collected via observation. So video camera, storage of the data would be great. Looking at, does the cat have issues, problems getting into the box? Does the cat have enough room to move around in the box? Is the cat happy with the litter? Looking at the motion that they use, there's a sequence of elimination, pre, during, and post behavior. Is there something that we can look at that can indicate maybe why they're not going to the litter box, or why there's house soiling, or maybe there's an arthritic issue, or things along those lines? Also, a camera outside the box gives you an indication, well, somebody wanted to get in there, but another one didn't want to let them in because there's a territorial issue going on. So, having some kind of visual monitoring system inside and outside the box would be my favorite, as well as, making sure that it's perfectly clean and is of good size and things along those lines.
Nathan, anything you want to add? I have another question for you anyway, so go ahead.
Yeah, no, for sure. Well, I mean, obviously they covered all of the health aspects of it, being able to monitoring and all that. But since I'm covering the content creator side, I'm going to say one, from what I've noticed with people, if it can empty itself and bag itself, and like take all the effort away, but still being able to monitor, perfect. And then, of course, again, being the content creator side, just something cool and new. I want bragging rights. I want to be able to look and be like, look how much cooler this litter box is than anything else. From the content creator side, if we're being honest. But yeah, if it can bag itself, take away all the work, and then also be awesome, done, perfect.
So, for any of your cat people, your followers, the cats could talk. What would they say to enhance or to change and enhance what they currently are using?
Oh, like I said, being able to actually have something that scoops the litter for them, because nobody likes scooping litter. Let's be honest. That is like that's one of the things that you're just like, oh, I have to do it, and especially if you miss scooping by like an hour, your place starts to smell. So like having it, scoop it, bag it, and just take that aspect, because that's one of the biggest, I'd say, from when I talk to people who are like, oh, I don't want cats. I don't want my place to smell. I don't want, it to smell like a litter box. But if it's scooping it and bagging it and just taking that and eliminating that, that's huge for owning cats. That takes away one of the biggest excuses that people have when it comes to owning cats.
Yeah. Jill, don't you wish, we're talking about all these things from our perspectives. Don't you wish we could sit there and ask the cat, what do you want? What makes you happy?
The cat would like a nice, clean, odorless box to walk around, to be able to dig a little bit, to eliminate and quiet, like not near the washing machine where it's going like this, or the dryer. Or in the middle of the playroom where the kids are running around, things like that. And to be able to be private and to be able to see who's coming and going. So just in case they have to dash out, that they can.
So there was a talking about some sort of data. It would be great to comment if we have someone had, I don't know if PETKIT had introduced it to us, but they were talking about a screen that we could show that would have a lot of this data already for us. And so when we see anomalies, when we see changes in what's going on, then instead of just shrugging it off and say, oh, well, but actually say, ooh. So which brings me to the next point. And that is, when we start noticing things that are different, that are off, all right, how relaxed should a pet parent be? In other words, should they jump on it right away? Should they be nervous about it? And at what point does that subtle change that may be nothing become a very important change that could be, health saving?
Yeah, I thought about this question for a little while because I could see some of my clients just going ape with the data and the visual data, and just calling me with every single little change. Because again, a lot of these people who are getting cats are younger. They don't have any other kids. These are their kids. And so they're like a helicopter parent. Right. So in order to help them, so if somebody was getting all this data from their litter box, and they were like, when should I call the vet, right? So what I would think would be, if you see in the visual camera bloody stool, or if you see diarrhea or soft stool more than 3 times in the box, I would say changes in weight greater or less, like a ½ pound change either way, up or down. Those are really important. Cats that go to the litter box more often, so maybe you're seeing that they're going 12 times in a day versus 3. Cats that are spending longer periods of time in the litter box, so normally they're in there for 2 minutes and they're done, suddenly they're in there for 5, 7, 8 minutes. That's in their straining.
Right.
I would say also they should be watching for any major increases in urine production for more than 2 days, or a major decrease in urine produced, especially coupled with increased frequency or time spent in the box. If your cat is having house accidents, or if they're acting sick in any way, or if there's a persistent changes in appetite, either up or down for more than 2 days, like that's my criteria. Call me, I need to get involved. Other than that, it's right. Just good data for you to know that your cat is healthy. But those things I would call a vet if I was seeing those.
Gotcha. And when you educate your clients, your pet parents, mm-hmm. How much impact, how much importance do you put on noticing changes and calling me, letting me know?
Mm-hmm. Yep. So, honestly, I try to tell everybody, but you can kind of read the room of which clients are going to listen to you and which clients are just kind of blowing you off and wanting to get out of the room. So I offer basics. And then if they express that they want more information, I will drill down. I have some cat owners that they were coming to me and they were like, I heard about this biomarker that detects kidney disease earlier. I want to get my cat tested. So it depends on how proactive they are and how much they're asking for me. I don't want to just bore people with a bunch of information, but if they really want to know, then I say, here's something, you write this down, you call me if you see any of this. So I try and give everybody the information. It's just some people don't want to listen. So
one of the facts you mentioned, Jill, when you said the camera, and how many times as an older cat has problems just because of skeletal issues and arthritis. And I have one of my boxes is pretty tall, right? And I wonder, unfortunately, my cats are good; they're using it beautifully, but to be able to watch a cat manipulate its way in and out of a box, I think that was a good point. It's really important.
It's critical. I mean, some people have, boxes where you come from up on top. An older cat can't do that anymore. Some people they keep their litter boxes from the time the cat was a kitten. It's not appropriate anymore. They need larger ones. And I just want to add something to what Dr. Wooten had said. First of all, house soiling issues. Sometimes when you have a multi-cat household, you don't know who's doing it. So there are things in place, to try to identify who's the soiler. Well, with a product that monitors who's going in and using the litter box, who's not going in to use the litter box. So you'll be able to identify the house soiler for sure. So that'd be a major, major help. Right. And the second thing is regarding subtle cues, as a behaviorist, and I'm sure the veterinarian field as well, we get a history. You get a medical history, we get a behavior history. And sometimes, many times actually, the client will say, well, it just suddenly appeared. Well, when you start to search and you start to mine what had been going on previously, you realize that there had been subtle cues long before it actually the problem became overt or big or noticeable, or the reason why they came to see you. So little subtle cues, any minor change, in my opinion, is necessary to make mention of it, because it's like any problem. You take care of it when it's small, it's less expensive.
Right. Dr. Sarah, you mentioned, or I know that do you have a real story that you can share with us?
I do.
Share, let us know.
I do. Well, I have two quick ones. One of them is heartbreaking to me, where if the owner had been monitoring the cat's toileting behaviors, the cat would still be with us today. And it was a cat that was in a litter box and the owner didn't notice because, we're busy, no judgment. And the cat kept going in. And the owner was like, why is the cat in the litter box all the time? So cat owner was like, finally, I'll take him to the vet. Brought him to the vet. The cat had a
bladder this big.
Urinary bladder was this big, and it was hard as a softball.
Right. Been there, done that.
Been there, done that, right? Cat died.
Yeah.
So if the owner had that tool and been like, well, this is strange. If I had seen that cat just even a little bit sooner, I could have saved that cat. I got another story from an owner actually who has an AI litter box that does the monitoring. And what this owner found was that they noticed that the number of times their cat was going to the litter box increased. And so the owner actually took the cat to the vet because of what they saw on the box. The veterinarian didn't find anything wrong, nothing. Like did all the tests, everything. Goes back home, still noticing that this cat is going a lot. Comes back because of the data that she got out of the litter box. Veterinarian runs more tests, different tests, finds a bladder stone that was translucent, which means that you can't see it on x-rays, that had become lodged in the urethra. And the veterinarian told this owner, if you had not brought this cat to me in this time, even a little bit longer, this cat would have passed away.
Right.
So I think it is vital for people to understand how critical this monitoring can be to the life of your pet.
Yeah. It's so true. The case that I had more recently, very similar, but he did come in on time, we were able to unblock the cat. But for everybody out there to know that male cats typically, because of the very narrow urethra, especially at the very end, are more likely to block from these stones. And these stones are often related to diet, to stress, to anxiety, to water intake. There's so many factors involved. We call it FLUTD, feline lower urinary tract disease. And it is so preventable if, as Dr. Wooden said, if we can make an earlier diagnosis, we can save these cats. And it's critical. So anyway, thank you for sharing that story. And I hope people learn. One question I have for Nathan. Nathan, you too have 4 cats.
Yes.
I have 4 cats. Do you consider yourself a cool hip owner or a helicopter dad?
Oh, I mean, I definitely a little bit of a helicopter, but I consider myself a cool dad. Like they're pretty spoiled. They got shelves and stuff all over the place. But I don't think I helicopter as much as I should actually. Because of my schedule. I monitor when I can, but I mean I'm traveling a lot and I work out of the house a lot. So still consider myself a cool hip dad, but I wish I could helicopter a little bit more than I do.
Gotcha. All right, great to hear. All right, so I think anyone else want to add something? Anyone want to say anything?
I was going to say a little story about one of my cases.
Sure.
Just off to the side, I have a client who has 8 cats because she wants to save as many cats as possible. And at the same time, her husband was terminally ill.
Right.
So she was the primary caregiver and pretty much the sole caregiver of her husband. And she was having a lot of issues. She was trying to integrate 2 foster cats into the main group, and she was having issues that were developing. And I suspect that a lot of the issues could have been resolved or prevented had she been able to look after the litter box issues, because the spraying started, which is probably one of the biggest complaints cat owners have, and why cats are surrendered to shelters. It's, elimination in the house, as well as a lot of spraying, which happens when there's intercat conflict. So, in cases like that, it would reduce the owners or the pet parents' stress and relieve them of a lot of responsibility that would create a more harmonious household. And that's basically our goal, is to create a harmonious household so that everybody enjoys and is at peace and stays in the house as long as possible and be healthy.
Absolutely. Thank you. So as we wrap up this, I think this discussion is great. I hope, a lot of people will see this and learn a lot. You say something to say?
Say something else.
Go ahead. Good. I love it. Go ahead.
Yeah, Dr. Jeff, I just want to piggyback on what Dr. Jill just said. We know a lot about chronic caregiver burden in people who are taking care of other people, but we're just now starting to understand the effect of chronic caregiver burden for people who are taking care of multiple pets. And the case that she just described, this poor lady's taking care of a sick person in probably palliative care, plus all these other cats. And we know that when you have chronic caregiver burden, because you're trying to do so much, you have reduced psychosocial functioning, and you can't think as well, and you're more reactive. And then these people will come into the veterinary hospital and they'll be really stressed out and reactive because they just have too much on their plate. Right. Something like this product could really go a long way in alleviating some of that chronic caregiver burden that Dr. Jill just described. And then I have one more thing. When I think about my clients, I went into this because I love people. I love pets, but I love people. And when I think about the younger generations, I'm so excited because they are mindful and they're also demure. And it's interesting because they're really wanting to learn more about how to take care of their pets and be proactive on the front end. So they're coming in and they're asking questions and they want to be educated, and they're extremely keen on proactive care. Something like a AI litter box is I think part of proactive care. So I'm really excited about products that are coming out like this, and for discussions with different veterinary and animal professionals like all of you guys.
No, obviously, it's definitely great. And it's so great to hear all the insight from our panel of experts here. So I wanted to take a moment to highlight the points for our audiences to start. you may have done it already, but just share a little final thought. Jill,
I
hands
want
up.
to say just one more thing. Can I just
Yeah,
say one
no,
more
I got one
thing?
for
Just
you
one more
too.
thing.
So.
It's pretty big because it's regarding stress, and people know, or if they don't, they need to understand that stress exacerbates everything. It makes everything worse.
Right.
And if we can add a product to our life that can reduce the stress not only of our animals but also of ourselves, then it would improve the whole living condition and the whole household in general.
Yeah,
Nathan.
I just gotta say, like, yeah, because I, like I said earlier, I love where technology is going. One of the things I do every year, I go to Super Zoo, which is like the big expo where like all the brands bring their newest and the latest. And I mean, there's new toys coming out that are amazing. There's like all sorts of new things coming out. But that's where I first saw the Pew Robot Ultra, which is like what we've been talking about, the AI robot that does everything. And honestly, I love it. I love the idea that we're finally being like, you know what? Humans, we're not perfect. And in fact, we're like not even close. So I love the idea of like, okay, we now have a robot that's going to come through. It's going to monitor your cats. It's going to take pictures of the poop on the inside. It's going to bag it to like, I'm so glad we're finally there. Like all the other things with technology, great. You know, we got drones. I was in an Uber the other day that drives itself. That's cool. But no, animal care, I'm all about it. Like, let's have robots finally take over. They do better. Like, I can monitor my cats all day and still not be able to know how much they weigh, how often they're going. So being able to have a machine just be like, hey, your cat has been going too much. You should check that out. Like, thank God, finally, because no matter how good you are, you're not going to be as good as a computer.
Absolutely. Absolutely. And Dr. Wooden.
Yeah, I mean, we've been talking a lot about the pet parent, but like as a veterinarian, if a pet parent came to me and had this data and was like, help me understand this, I would be so excited because
Right.
I know when that pet parent leaves that cat's going to be monitored and they're going to come in if there's something wrong and I'm going to be able to help them sooner. It's going to be less expensive. There's going to be less pain for the cat. There's going to be less suffering. There's going to be more likelihood that we get to keep that relationship intact. So as a veterinarian, I feel like something like a smart litter box could really help reduce my stress too, because it's also stressful for me when I see patients with an end stage disease that I know I could have saved them or done a lot better if I'd seen that earlier.
Well, there's an expression that's been around forever. Knowledge is king. And if the owners, the pet parents have the knowledge and then they can share that with us as veterinarians, as animal caregivers, then we, again, the ultimate, well, both of us win. The pet parents win because they can spend longer and more time, quality time, by having their pets healthier for longer. And of course, the pet wins because they're still here. And problems that probably, if we didn't have this AI assistance and the new amazing technologies in things as simple as a litter box, who knew? Sarah, when you graduated vet school 20 plus years ago, this wasn't even, and it's every time I drive by one of those cars, the Waymos, you've seen them in LA. It's the weirdest thing. I look inside, there's no driver. So,
yeah, no, back in vet school, I had one of those Palm Pilots.
Right. It's so true. So I think it's great. Jill, yes?
Because I don't know if we'll ever stop talking because the next everything somebody says, it brings up something else. But you're talking about time. The time that is allocated to, I have to clean the litter box. I have to change this. I have to do that can now be allocated to, let's play with my cat. Right? And play and exercise and interacting with the cat in that way is so positive to their overall well-being physically and emotionally and psychologically. So yeah, it's a saving of time, and we are all limited with how much time we can give our pets. But if we can actually play with them and improve our relationship with them by interacting with them, that's a huge benefit to this smart litter box as well.
You talk about AI. I believe it or not, I don't know if you've heard of this, Dr. Wooden, but I use AI to write out my medical records now. And if I tell you, it's saved me hours a day, hours. Mm-hmm. And so then, Jill, to your point, I get to go home and play with my grandkids and my pets instead of sitting here. So, it is fascinating. So, I mean, I think that we can see that the use of a box like this, Pure Robot, and the Ultra, it's amazing. You got to look into it. I just want to. It's a great solution to help prevent conditions, disease. Not prevent necessarily, but at least give us a head start in treating. Would be great if we could prevent it in the first place, but that might be that's another thing. But anyway, I want to thank our sponsor, PETKIT, for bringing not only this together, but for the amazing technology. So anyway, it's very important that those of you learn something from this, and if there are any if you're like for the audience out there, whether you're like just a geek, a technology geek, or just love your cats and you want to help them with their behaviors, I hope you walk away with some information here of some of the great things that they're out there for you to make changes in how you deal with your pets and how you keep them healthy.